engineer. Oh. Good evening, each and every one of you. And I certainly want to thank you for joining us here at Chicago State University this very evening for this important conversation about this greatly misunderstood COVID-19 epidemic, and the only way that we can get out in front of it and stop it in its track. Let me be clear. I'm a firm believer that you can't teach what you don't know, and you can't lead where you won't go. I already got my shot. And I got it as soon as it was available to me. I'm glad about it. Look, it's been a difficult year of social distancing for your friends and your family. But let me tell you, I want the same vow as you, getting my shot as a result of the distance between me and my family. Getting my shot was a far-out priority with me. I couldn't wait. I was excited about the appointment and about the opportunity to go and get my shot. I couldn't wait. The vaccines are your way, my way, or my way, back to a sense of normalcy. You know what I mean? Seeing our friends, hugging our relatives, going to sports games, enjoying the spring and the summer, attending concerts, even going to church. And most importantly, connecting in person to all those who mean so much to us. This dreaded disease, COVID-19, has already killed 567,000 Americans, like you and I. More than 3 million people across the world have died from this dreaded disease. This disease don't discriminate. Every age group, people with underlying health conditions, even those in perfect health, have fallen victim to this disease. And while COVID-19 has infected Americans of all races, it's the black people, black Americans, who have paid the most tremendous, the most difficult, the most astounding of the price for this dreaded disease. Black Americans are 3 times as likely as white Americans to go to the hospital for this disease and twice as likely to die from this disease. Let's face it. Let's really agree on one point. These vaccines are our tools that will save and that are already saving countless lives all across this nation, in our neighborhood, in our city. This week, it's been announced that everyone that's 16 years of age can now get this vaccination, this vaccine. You can get your shot at 16 years old. You can't drink, you can't drive, but you can get your shot if you're 16. There are a lot of questions about this vaccine, a lot of rumors, a lot of conspiracy theories, a lot of misunderstanding, a lot of fear. Don't let rumors, misunderstanding, and fears be the enemy that steals your life away. The Bible says, know ye the truth, and the truth shall set you free. That's why I'm convening the panel tonight. It's important that we get the real deal, the true facts about the vaccine. It's also equally important that we understand the risk of COVID-19 and how the vaccine can reduce those risks beyond all measure. They can reduce the risk the vaccine can. This very evening, tonight, is your night to get your questions answered by a trusted health professional. And I hope that after tonight's panel, that you get some guts, that you get some courage, that you become confident. Look, let me just say it like this. If we were giving away chicken McNuggets in the hall tonight, the hall would be overflowing. And most of you who would be here don't know what is in that chicken McNugget. You trust McDonald's. You ought to trust the doctors who are telling you that the only way that we can meet this pandemic and stop our loved ones and our neighbors from dying from this dreaded disease, and that you and I get our vaccine. Get your questions asked. Ask Eric questions that you might have. Bring the rumors up. Bring the conspiracies up. listening down to some real answers to real questions. It goes without saying for me that I really appreciate this panel that's come here to Chicago State. And I look forward to their informative presentation. And I want to thank our audience, you who are taking the time out to learn more, to be better informed. If we know better, then we ought to do better. 24% of our neighbors have been vaccinated in the city of Chicago. That means that 76% of our neighbors have not. The only way that we're going to beat this pandemic is for you to join me in getting your vaccine. I want to thank you, and come on now. Stop playing with Russian roulette with your grandmamas and your granddaddies and your uncles and uncles, with your mamas and your daddies. Stop playing Russian roulette with their lives and your lives. Get your shot. Get your vaccine. Let's whip this thing. We can beat it. Thank you all. And now, I have the distinct honor inviting President Z. Y'all hear me now? President Z of Chicago State University. This woman who runs this institution remarkably with all kinds of excellence. I love to work with her because she is a sister who I believe in, and she is a sister who really, really, really knows what leadership is all about. Want y'all welcome my good friend, President Z.
Thank you, Congressman Rush, for those kind remarks, and I want to say good evening on behalf of Chicago State. My name is Z. Scott, and I am the president of the university, as the Congressman introduced me. I am delighted to welcome you this evening, virtually, to Chicago State for tonight's important conversation. Congressman, I'd like to thank you for your leadership in convening tonight's panel. He is our host partner, and he is one of the reasons that Chicago State has enjoyed much of the success we have enjoyed on the southeast side of Chicago. And we thank you for your invaluable partnership and your service to the citizens of Illinois' 1st District. I also want to give a special thank you tonight to our phenomenal panelists, Dr. Daria Terrell of St. Bernard Hospital, Dr. Armo Torkars, Assistant Director of the Illinois Department of Public Health, and Julianne Collins, Nurse Practitioner from Friend Family Health. We're also proud to welcome tonight one of our own, our conversations moderator, Chicago State's Dr. George Smith, Assistant Professor of Public Health. Thank you all for joining us. As this country continues to experience this pandemic, we must not lose sight, as the Congressman said, of the seriousness of COVID-19. As a predominantly Black institution on the southeast side of Chicago, we have seen firsthand the devastation of COVID-19. And in order for Illinois to truly respond and recover from from the pandemic, all Illinoisans, including our neighbors on the southeast side of Chicago, must vax up. I have been vaccinated, And like the congressman, I waited for the first available opportunity in order to receive my vaccination. I wanted to see my family. I wanted to see my friends. And I did not want to be the person who was afraid of getting the vaccine, but also who did not do the best I could by my family and by my leadership at Chicago State University. So that's why we're inviting you to come down to Chicago State University and get your vaccine. Appointments are being scheduled online, and while that online process is highly encouraged, but it requires that you provide a gift zip code. But beginning this week, you can walk in for vaccinations here at Chicago State, and no zip code is required. All you need to do is show up and get vaccinated. There's a lot of excitement and energy on our campus about getting vaccinated. Because vaccinated, again, as the congressman pointed out, gives you so much more freedom and so much more freedom of thought about what your life possibilities could be once you are vaccinated. And at our university, we are diligently working for a full, open, and full return to in-person instruction this fall on our campus. We have released our operating plan and know that we will be fully open to our students, our community, and our staff. So we urge everyone to pay attention to tonight's conversation as an example, and use it as an example of what can come from collaboration between community leaders. We have a commitment to providing full access to the vaccine for our community. We ask you to stop on by, raise your sleeve, and take your vaccination. Again, thank you for being with us tonight, and please listen closely to tonight's informative conversation.
Thank you, Congressman Rush and President Scott. Those were some inspirational and factual words, so that was really great. We would like to thank them again. Receiving the vaccine is vital to lowering the spread of COVID-19 in the country. And I apologize, I'm so focused on being compliant with COVID-19 prevention, I kept my mask on, so I'm sorry. I just really want to make sure that we don't spread the disease, and I have to practice what I teach. Okay, so each of the panelists are on the front lines in our efforts to get Illinoisans vaccinated. As a reminder, if you have any questions for the panel, please drop them in the comments below. You can see that. And also, please like and share this broadcast. With that being said, let's get started. Our first panelist is Dr. Daria Brooks-Terrell. Dr. Terrell currently serves as the Medical Director of Clinical Programming and Health Outcomes at St. Bernard Hospital, one of our great safety net hospitals located here on the south side of Chicago. A graduate of Brown University and Case Western Reserve University School of Medicine, she completed a residency in orthopedic surgery at the University of Pittsburgh and a fellowship in orthopedic oncology. She worked for several years as an orthopedic oncologist in Washington, D.C. before returning to Chicago. Dr. Terrell has been practicing general orthopedic surgery at St. Bernard Hospital since 2011, where she serves also as the chairman of the Department of Surgery. Now we'll hear from Dr. Terrell.
Good evening, everyone. I would like to thank Congressman Rush and his team, as well as President Scott, for the opportunity to be a part of this very important conversation. I think that this is so important, and I'm so glad that everyone on this call is taking the opportunity to make themselves more informed. I think through all of this, a lot of you are now aware of Dr. Kizzmekia Corbett, who's the African-American female scientist who led the Moderna team in developing the vaccine. And in a recent interview, she said we should stop maybe talking about vaccine hesitancy and call it vaccine inquisitiveness. And I like that. And I'm going to piggyback off of her and congratulate you all on being inquisitive and showing up today to get more information. And with that, let's talk a little bit about the virus and this vaccine. We can go to the next slide. What I would like to do is really talk about why it's important to consider getting the vaccine for all of those who are still on the fence. So, as over the last year, the city has done a remarkable job of collecting data about the virus and especially as it relates to our different communities and how the communities are impacted. And for those of you who are able to view this on a screen, what you're looking at is a map of the city of Chicago that's broken down by zip codes. And this is a map from actually last spring when we were just starting to see different trends in the data. And unfortunately, what we noticed was that in our Black and Latinx residents in the city, they were 2 to 3 times more likely to get COVID-19 virus than their white counterparts, as Congressman Rush just reiterated. He also talked to you and said that they're 4 times more likely to be hospitalized. And unfortunately, we were 3 times more likely to die from this disease once we got it. And I will tell you, for me, as a human being, that was one of the main driving forces for me to consider getting this vaccine. Because, like you, I had questions. I had some of the same doubts and a lot of the same inquisitiveness that a lot of you that are listening today had. But I started listening to the data, and hopefully, I'm going to share more things with you as we move to the next slide that helped me decide to get the vaccine. One of the things, again, the main point of the vaccine is to try to prevent the chances of you dying from getting COVID-19. To date, as Congressman Rush said, there have been 568,000 Americans who have died from this disease. And don't believe the people who say this is just a disease of the elderly. This is just a disease because people were sick. There have been people who were elderly and people who've had conditions, but there have been just as many people who died who had no conditions, who had no pre-existing illnesses, who still succumb to this disease. And that's why we need to have this important conversation. If we move to, I think, maybe the next 2 slides. Okay, and then one more. What I really want to talk about, again, is how this has affected the African American community. We have come to realize that the people who have underlying conditions or underlying medical problems were more likely to contract the virus. And unfortunately, they were also the same people who were more likely to have severe complications from the virus. And so what we also know is that African Americans have higher rates of these chronic conditions. And these are things like asthma, diabetes, hypertension, obesity. And you may have heard people mention comorbid conditions. And then that's what these are. These are the underlying medical conditions. But all of these things put us at risk for contracting the virus. What we also know is that 1 out of 800 African Americans died to COVID compared to 1 in 1,300 of their white counterparts. We know that as African Americans, we often are the victims of undertreatment. So we're not treated with the same regimens. We're not offered the same treatment as other Americans in this country. And we also don't always have access to the same quality of care. And I will suggest to you and ask you to think about that this vaccine represents one moment in our time, one moment in our history where for once we have the opportunity to get quality care. We have the opportunity to get the top of the line treatment for a problem instead of someone offering it to us 6 years after everyone else has been enjoying the benefits of the treatment. So I would ask you to consider that this is something that we should all be doing to lessen the chances of this impacting our community. One other thing as we move to the next slide that I would also ask you to consider. So we know that there are people who get COVID-19 that don't have any symptoms at all. There are those who quarantine for their 10 days and they go on with their life. What we don't hear as much about is the more than 10% of the population who have what they call now long COVID. So these are people who, after their 10-day period of quarantine, have had serious, long-lasting effects from COVID-19. And these have been things like kidney injury, where people who weren't on dialysis have ended up on dialysis. These were effects to the heart, effects to your brain. So people complain about, my memory's not the same, I can't think. These are complications involving how you breathe and your respiratory system. So people who weren't requiring oxygen before they contracted COVID-19 ended up on oxygen. So these long-term effects of COVID are just another reason that you want to consider getting the vaccine to prevent you from ever having this disease that causes these problems. And I'll add one more reason that we should consider getting the vaccine. As Congressman Rush just mentioned, as of this week, anyone over 16 is eligible to get the vaccine. However, those who are under 16, so all of our children, are not yet able. It has not been approved. The two vaccines that we have, Pfizer and Moderna, are not approved for treatment in people who are under 16. So that means it's the responsibility of all of us who can get the vaccine to be vaccinated to help protect our children. Right now, the rates of COVID-19, I should say, in children are rising. And for the first time, we have the highest rate of COVID-19 in children. It's about 20% of all kids in this country have or have had COVID-19. So now that we've thought a little bit about why we should get the vaccine, let's move to the next slide. And I'm going to spend maybe just another minute or so trying to explain to you why the vaccine works. And it's important to talk about this because I know there are a lot of rumors and a lot of speculations about this vaccine. Let me tell you what these vaccines are not. So right now, we have Pfizer and the Moderna vaccines that are available right now, today, for you to be vaccinated. As we all have heard, right now, the Johnson & Johnson vaccine has been put on pause. So that is not available. So we're going to talk about the two vaccines that are available right now. What are these vaccines and what are they not? These vaccines are not giving you COVID-19. These vaccines are not microchips. They're not ways of tracking you. They're not devices that are being implanted in you. These are not things that are put in your body to change your DNA. That is not what these vaccines do. The Moderna and Pfizer vaccines are the product of what's called mRNA or messenger RNA technology. And without going through all the science, I'm going to try to use an analogy that I used before that I think might help explain how they work. So I need you to bear with me a little bit and pretend that we're going to be in the middle of a James Bond movie, okay? So let's say James Bond comes, he drives up in his fancy car and he says, hey, there's a new enemy out there. It's the coronavirus, okay? Now, as we're talking about this, I want you to picture what you see on the screen, the image that we've come to know as the coronavirus with this little round ball with these little spikes. So James Bond comes and says, our new mission is to get rid of the coronavirus, okay? This is the enemy. Should you choose to accept the assignment? You know how the line goes. Okay, so of course we're going to accept the assignment because we all want to get rid of it. So he tells us, I'm going to leave a secret code for you. Then he drives off in his fancy car. Now that code that he leaves behind, that's what this vaccine is. The vaccine is a special code that tells our body, hey, look, when you see this spiked jacket that's on the outside of the coronavirus, you're going to know that's the virus. You don't even have to see the whites of the eyes. You don't have to see the center. All you need to see is that spike, that little spiky jacket on the outside. And when you see that, that's when you know the enemy's there. So the code, which is basically a protein that's in the vaccine, tells your body how to recognize coronavirus, and in particular, how to recognize that spike protein on the outside. And then it tells your body, okay, when you see this, you got to mount your army, which for us in our body is the antibodies. So just like in a James Bond movie, the secret code, what does it do? It disintegrates, it self-destructs. Same thing happens. The code that comes with the vaccine is broken down and destroyed by our bodies within 48 to 72 hours. The first dose of the vaccine tells your body what to look for. And by the second vaccine, you're building your army, you're building your antibodies. So by the time you encounter someone with COVID-19, your body says, wait, I see that red jacket. Okay, that's the enemy. Let's mount up our antibodies. Let's mount up our army. They guard you, they protect you, and they keep you from getting COVID-19 in the majority of cases. And that's the whole point of getting vaccinated. We want to keep everyone safe. We want to keep you alive. And let me just say, on the rare instances, because I'm going to put it out there, there are a few instances where people who have been vaccinated fully have contracted and have tested positive for COVID-19. But the majority of those cases, some of those people didn't even know that they were positive for COVID-19. And that's what we want. We want you not to get the virus. We want you not to die from the virus. And if you do contract it, getting the vaccine keeps you from being as sick. And I'll leave it there.
Thank you, Dr. Terrell. I will never think I will ever see a James Bond movie again and not think of COVID-19. But our next panelist will be Dr. Amal Tokars, and she's humbled to serve as the Assistant Director of the Illinois Department of Public Health. Her doctoral work emphasized her love for organizational learning, social movement, and research methods, as well as the Candid in anthropology. Her graduate and doctoral work was completed at Northern Illinois University, located in DeKalb, Illinois. She is also a graduate of the Navy Postgraduate School's Executive Learners Program, which was located in the state of California. Her work experience includes over 30 years in behavioral health work and approximately 15 years in the public health arena, as well as clinical, policy, and research experience. Her areas of passions include cultural equity, health ethics, system change, international policy, and engaging in dialogue about the essentialities of a thriving civil society. Dr. Tokars.
Thank you so much for having me. First, I want to make sure that you can hear me. Are you able to hear me?
Yes, we can hear you. Yes,
Okay,
very well. Thank you so much.
Wonderful. So there were so many excellent and truthful comments made before my turn. So I want to make sure that I'm not overlapping that. I'm going to say some affirming and other things to you that I hope will help in building your confidence around this vaccine. So one of the things that we have begun is what's called a Community Ambassadors Initiative. These are individuals that are non-healthcare professionals and non-public health professionals that live all across Illinois. Very diverse in race, very diverse in socioeconomic status, and in every county across the state. These are individuals that want to be in the know about the vaccine and want to share what they know, their experience about a local clinic, things that are true and things that they know are not true. And so I will be sharing that information with the organizers of this panel. And I want to make sure that any of you that are interested in signing up for that can know. When people ask questions about the vaccine, all of the questions are very intelligent that I've heard, and they're very earnest. So some of the questions that I hear are things like, is this a live vaccine? So there is nothing wrong with a live vaccine, but I think you have just heard a wonderful description of this being a vaccine that is something different from that, but does trigger your immunity. And so what are the normal side effects that most people experience? And these are normal and common. Most people do experience a sore arm. Not everybody does, but most people do. It is also very common and normal for people to have side effects that mimic them feeling a little bit ill, like being very tired, like having a headache, like having some temporary congestion, um, um, even having a little bit of an earache for some people, or some people may report starting to have a little bit of a runny nose. Know that if you are experiencing this headache as a side effect of having your vaccination, you are not contracting COVID, although it's a very understandable question that people have. And so, nor can you transmit COVID. These are normal side effects. This is your immune system speaking loudly, getting up and standing up as it should. And if you speak to people that you know, not rumors, but speak to people that you know that have had these side effects, ask them exactly what they were like, and then ask them how they're feeling now. And then that's really important. So I waited to become eligible to have this vaccine, and I just recently became eligible like you. And I just received my first dose 3 weeks ago. And this week, I just received the second dose. And I want to tell you what I experienced. And what I experienced is not the same as what everybody will, but common. So I felt a little bit of congestion and extremely sleepy and extremely tired. Um, just that night and a little bit the next day, and then it was gone. I had this side effect a little bit with my first dose and a tiny bit more with my second dose. So that was on Monday. And then yesterday I felt that a little bit, and I woke up, sorry, not yesterday, Tuesday a little bit. And then Wednesday I woke up, just felt wonderful, just wonderful. So it's a little bit different for everyone, but I wanted to share with you my experience because I very recently had that. These two vaccines, and Pfizer and Moderna, are both high efficacy, high quality vaccines. High efficacy meaning have a tremendous amount of ability to prevent you from getting this terrible sickness. I want to also mention to you, and I know that our time is short, but I want to leave you with this. Human beings are the only species on this earth that can discern with wisdom. So you have to choose for yourself what you trust, and you have to choose by intelligent and wise discernment and hearing the truthful things that have been said to you this evening thus far, and speaking with your healthcare professionals that you trust and asking good questions. This is good to ask. But then you must discern. And in that discernment and that wisdom, you know that this is not just about the benefit to you. We are a people or peoples connected to one another. What you do and what you choose affects so many of your brothers and sisters, knowing that the young children, cannot be vaccinated. If every adult does not stand up with courage and take their turn, then it can really have some significant repercussions for all of our brothers and sisters, not only in Illinois, but in the country and in the world. And we are very fortunate to have this resource in front of us. And when we are fortunate, we should see it with our eyes open and recognize that, because we are all connected to all other brothers and sisters on the entire globe. Thank you so much now.
Dr. Kopars, thank you so much for that passionate information. We do appreciate that. And now we'll have our final panelist, and that's Ms. Julianne Collins, who is a nurse practitioner at the Friend Health Center in Chicago, where she works in family medicine and urgent care. She embraced family medicine and community health while working with the Indian Health Services caring for Native Americans and indigenous people with diabetes and hypertension in Arizona, while completing her Doctor of Nursing Practice degree, which was obtained from Indiana Wesleyan University in 2017. She is also passionate about public health and has been one of the lead providers in working with the COVID testing team at the Friend Health Center, which operates 5 testing sites across the south side of Chicago, providing need to underserved communities regarding the importance of COVID-19 testing and vaccines. Now we'll have Ms. Collins.
Hi, good evening, everyone. Thank you, Dr. Smith and Congressman Rush and President Scott for inviting me to be a part of this very important conversation. I'm Dr. Julianne Collins, nurse practitioner at Friend Health Center in Chicago, where we are proudly doing our part in the fight against the pandemic by providing coronavirus vaccination and testing to communities on the south side of Chicago. We currently operate 3 vaccination sites and host numerous community events, bringing vaccinations to underserved communities. We as a community and a nation over the past year have struggled through self-isolation, isolation from loved ones and friends. We watch our favorite stores and restaurants go out of business. Our schools closed, our jobs became virtual, and for some of us became non-existent, because we all had to stay home to stay safe. And we wondered when it would all end. With the development of coronavirus vaccine, this brought hope and the possibility of life returning to normal. But with this new vaccination came a lot of questions, mistrust, mistruths, and a lot of unanswered questions, which brings us to the crossroad of vaccination hesitancy. The number one reason when I'm talking to my patients that I hear is that they do not trust the vaccine. Some individuals do not trust the vaccine because they believe it was created too quickly. So I'll try to explain to you all what I tell them when they bring this to my attention. Scientists have been creating the vaccinations for years. Some vaccines that were created are like the chickenpox vaccine, the measles vaccine, polio vaccine, and even the flu vaccine. Although the virus is new, the technology of creating vaccination is not new. And scientists have incorporated this technology that was available to them when creating coronavirus vaccine. Thus, they saved a lot of time by not having to start from scratch. Another reason that I tell them is that what contributed to the speed of creating the vaccine is the fact that under normal circumstances, most clinical trials usually enroll fewer than 3,000 participants and usually take up to 1 year or more to see how vaccines work. But due to the serious nature of coronavirus, between 30,000 and sometimes as many as 50,000 participants were enrolled in each trial, thus enabling the data to be collected and analyzed under 4 months. Another reason was the need that the vaccine was so great, instead of waiting to produce the vaccine one step at a time in the past, which was done with other vaccines, government agencies stepped in and invested millions of dollars to produce the vaccine while the test data was under review. So when the review process was over and the vaccine was given the stamp of approval by the FDA, production was completed in a matter of days, and voila, we had our vaccine. Some other individuals worry about the side effects, which was discussed a little bit. Some of the common side effects that were mentioned were like pain and redness at the injection site, tiredness, headache, muscle pain, fever, chills, and sometimes nausea. What I tell my patients is that if you experience these symptoms, they should last between 24 to 48 hours. They can be treated at home with over-the-counter pain medicines such as Tylenol, which most of us have in our medicine cabinets. You can also increase the amount of fluids that you're taking in, and you can get a little more rest. Now, if you experience any of these side effects that continue for more than 24 to 48 hours, you should probably contact your primary care doctor just to get an evaluation and some follow-up care. Now, if you experience an allergic reaction, and this usually happens within 4 hours of getting the vaccine, and these symptoms tend to be more serious than the ones that we discussed earlier. And these symptoms can include swelling to the face, lip, or tongue. You could get hives all over the body. You could have some problems breathing. If you experience any of these, you should probably seek care from the nearest emergency room, and you probably should refrain from getting a second vaccine. Now let's discuss the protection from the vaccine. Most of us wants to know how soon after the vaccination will we be protected? Protection will typically begin 2 weeks after you have been fully vaccinated. And that includes all 3 vaccines, well, 2 vaccines currently, since the Johnson & Johnson vaccine is on hold. All right, we also want to know how long will the effect of the vaccine last? Well, because this is a new virus that we have never seen before, it is hard to tell. Experts are still learning more about how long vaccine protects us against COVID-19 in real-world conditions. So we'll continue to check with the CDC for updated information, and we will definitely let you know as soon as we have the information available. Now, mothers who are pregnant or planning to get pregnant also wants to know, should they get the vaccine? There's currently limited data about vaccine and pregnancy. However, there's no contraindication for pregnant or breastfeeding mothers to receive the vaccine. They can receive any of the currently authorized COVID-19 vaccines after a discussion with their OBGYN and consideration of their personal risk of contracting the virus. There's also some question about fertility with getting the vaccine. And for those of you who want to get pregnant in the future, there is no evidence that fertility problems are side effects of any vaccine, including the coronavirus vaccine. Other people want to know, can I get the vaccine if I'm sick? So if you have a runny nose, a cold, and want to get the vaccine, my answer to is yes, you can get the vaccine, but I would recommend that you wait until you feel better, and not because this is contraindicated, but because you don't want others to get sick as well around you. As healthcare providers, we're tasked with the responsibility of not only providing care, but educating the community as well. I know that most of us have heard the saying, knowledge is power. So we are here today to share our knowledge and to give you the power by answering your questions and providing you with the information you need to help you make the right choice to protect your health, the health of your family, and the health of your community. Back to you, Dr. Smith.
Thank you, Dr. Terrell. Thank you, Dr. Tokars and Dr. Collins. They have given us some very valuable information. I would say, if you give us the emoji where you're clapping your hands, that'd be real good. However, but thank them so very much. As you know, vaccines are very important. Before we get into the Q&A portion of the program, we would like to invite Mr. Christopher Thomas to share his vaccine journey with us. Now we'll hear from Mr. Thomas.
Hello. Yes, I'm just going to give a brief on my experience. My name is Christopher Thompson. I'm a network administrator here at St. Bernard Hospital. I got vaccinated early, right away in December, second shot, into January, and I had the soreness on at this shot location on my arm, but I really didn't have any other symptoms. I was paying attention. I was anxious to get the shot. But at the same time, got a little nervous, like this is new. But the second time around, I was ready. I had no issues with the first time, so I felt good. And the primary reason is to promote my own self-help, but I also did not want to get sick working in a hospital or being out and take anything home. I have a large family, so I wanted to protect myself and protect my family as well.
Thank you so much, Mr. Thomas, for sharing your story. We have not reached the Q&A portion for this evening. Please continue to drop your questions in the comment box. However, please advise that we would like to limit our questions to COVID-19 related matters. However, if you need any assistance with any other issues related, you can contact Congressman Rush's office at 773-779-2400. Again, that's 773-779-2400. He's been a long-standing congressman, so you know he'll get back with you if you have any questions outside of COVID-19. But I have one right here that any one of the panelists can answer. Here we go. Are there any new vaccine offerings being proposed for the future for COVID-19? I won't pick on anyone, but any one of the doctors who got 3 of them, and I think they all can answer that.
Could you repeat the question? Oh, go ahead.
Sure. Are there any new vaccine offerings being proposed for the future to combat or to prevent the onset of COVID-19?
There is not any new vaccines that we have heard of. There's only 3 that are available right now in the US, and 1 is on hold, and the first one is the Pfizer, then there's Moderna, and the Johnson & Johnson, which is currently on hold. There is the AstraZeneca, but that is not being used in the US at this time, and I do not know of any future opportunities for us to use the AstraZeneca.
While there aren't any new prospects for other vaccines, I think a lot of the work is now really being focused on trying to figure out where do we go from here and trying to decide whether we need boosters and how to determine when that will need to be, how often, and and whether there are going to be any differences in different populations or age groups. So I think there's more attention to that, more so than developing different vaccines. There's also another, other than the AstraZeneca, there's a Sinovac vaccine, which is also not being considered here in the US. So there are others. There's some that are being used in Asia, but our focus right now is trying to figure out the next step, which is to booster or not to booster.
I also want to mention, in addition to the vaccines, that there are 2 other tools that are very, very important for us at this time. Testing is still so very, very important. And also there is an antibody therapy, which is treatment for individuals that are recently diagnosed. It is a treatment that does have some efficacy, and individuals should speak with their physicians about this, especially if they have certain comorbidities. These are very important tools for us. The vaccine, the testing, and this treatment, which is done on an outpatient basis as infusion. Now, also the other tools are the things that we know. That is the masking that you have demonstrated, Dr. Smith, and the social distancing and staying away from crowded places. These are tools that we also have with us while we are waiting for our brothers and sisters to get vaccinated. These other things are also very, very important for us.
Thank you. So I'm just going to go ahead and because I teach ethics here, and so I always teach my students the truth about the Tuskegee syphilis study, which was otherwise known as the study of untreated syphilis in the American Negro male. So we know, we've read medical apartheid. So is this a disease designed to kill African Americans? And will COVID-19, is it a conspiracy? Is it out there? Is it going to just kill African Americans? And if we take it, how do we know we're not being experimented on? How do we know this is not a big experiment? Because of that, but it's out there. We know it's out there. How can we address that?
I don't think that we can say that this virus is intended just to eradicate the African American race because of the widespread prevalence of the virus. I mean, we've seen the virus affect and have such devastating effects across the globe, literally. So it's not just African Americans, but the conversations, the hesitancy, the questions, the anxiety that come and arise because of Tuskegee are valid. I think that acknowledging that there have been many instances, and not just Tuskegee, and there have been more recent instances where the medical culture, if you will, has failed African Americans, and so people are right to be cautious. But the other part of this is that the way to address that is to ask questions, to have data. We also have to acknowledge that because of things like Tuskegee, the guidelines that have been put in place that have been strictly adhered to for the development of Pfizer, Moderna, and Johnson & Johnson are all there to prevent things like Tuskegee from happening in the future. So the point of the vaccine is not to get rid of us or any other cultures. It's to actually to extend our life and to keep us from dying.
Thank you. I have another question, and this question has to do with herd immunity. Some people think it's HEARD, but it's herd, HERD. When will we get to herd immunity, and what is herd?
Herd immunity has not yet been landed on for the exact number that we need to achieve for COVID-19, but we do know that we need it to be most of us. And so, as one of my colleagues said earlier, and I have also said, since we know that most children are not eligible to be vaccinated, it really does mean most adults. In order to protect one another and the children, it will be most of us. It must be most of us.
Thank you. And there's another question. Are there some, all right, go ahead. And we have another question, and this has to go in regards to some gender differences. Could any of you speak in regards to, we encourage women to get mammograms. So we know that prevention, early detection of breast cancer is really monumental in preventing morbidity, particularly among African American women. If a woman how should she get her COVID vaccine before getting her mammogram? How should she go about it? How should she do that? I know, of course, she needs to speak with a primary care provider, but what is some of the general information out there so that we can educate those women who are really focusing on preventing and early detection of breast cancer?
Okay,
Go ahead.
I think the question, I wasn't sure of the question. Is the question asking, should they get a COVID vaccine before they get a mammogram? Is that what the question is asking?
How should they, some, you hear different things in the community. Some say, oh no, my doctor told me to get afterwards. And some say, oh, I got a false positive and I should wait. Those types of things in regard to getting your mammogram.
Well, basically, I don't think the two are related. You should definitely get your mammogram every year. You should definitely go get a screening for your mammogram to prevent breast cancer, to prevent early detection of breast cancer. And you should get your COVID vaccine so that you do not contract coronavirus. So I don't think either way, if you get it before or after, I don't think they won't interact with each other. I don't think they're counteracting each other. You could either get it before or after.
I think I'll just add to that. One of the things that was recommended, because there was some thought that there might be some people who had a mammogram and then had false positive readings that they thought were related to the mammogram. So it's suggested that when you schedule your mammogram, that you mention whether you've had testing or the vaccine, and that if possible, you keep that in mind and, not schedule them within the same time, not schedule them within a close time frame. But again, it's more important that you not miss your screening. So if you do go ahead and have a mammogram in proximity, it's recommended that you do mention that to the technician that does the mammogram so that they can make note of it, so that when they read that, they will take it into account.
We have one last question, and anyone can answer this. It says, can you speak to gender differences, or are there any in regards to side effects from the vaccine?
Gender differences and side effects. I think side effects are not really related to the gender. I don't think there's a lot of study being conducted yet about the side effects based on gender. Side effects now are just basically in general, and not everyone gets these side effects. I think they're being reported on VSafe, so maybe later on down the road, because the new vaccine is so new right now, after they've collected sufficient data, they will probably be able to separate these by gender. But right now, I don't think they have data on gender specificity based on side effects.
Thank you so very much. This concludes our program for this evening. I would like to thank Congressman Rush as well as President Scott and all of our panelists for joining us this evening. You've done a tremendous job in educating the public and helping us determine fact from fiction. One thing that I would like to say that we here at Chicago State University, which I affectionately call a Little Jewel on 95th and King Drive, we are a site that is providing the vaccines. As stated, we are taking some on-site vaccines, on-site appointments, but we really would like for you to schedule if possible, because that helps us better to determine how to service the community when they're coming in. I will give you a phone number. That phone number is 312-746-4835. Again, that's 312-746-4835. At the beginning, Congressman Rush did say 16-year-olds can get the shots, but if you're between 16 and 17, you have to bring mom, dad, grandma, whomever, and they too can get the shot. Again, thank you so very much. We appreciate you for taking time out of your busy schedule to be with us this evening. And remember now, get it.